Dr. Brian Heaberlin here with Lexington ENT and Allergy. And a parathyroidectomy is a surgery that's commonly performed to remove an abnormal gland in the lower part of the neck. So around the thyroid are these glands called the parathyroids that help regulate our calcium levels in the blood. A common problem with these parathyroids is they'll develop a benign tumor called a parathyroid adenoma, and that tumor over-secretes the parathyroid hormone, which drives the calcium in the blood up. Now the problems that this can create is it can cause people to have kidney stones, it can steal the calcium out of the bones and cause osteoporosis. People can sometimes have chronic constipation or abdominal complaints. They may even have memory issues, fatigue, depression. Those are all common things that we see in people with what's called hyperparathyroidism. So if you've been worked up and your parathyroid needs to be removed, the surgery takes typically about an hour and a half to 2 hours to do if they've been able to localize the gland. And we often do these studies beforehand to try to find which of the glands is abnormal so that we can a little more precisely go in and remove that without disrupting as many other things. If they've been unable to localize the parathyroid, then it can be a little more unpredictable on the timing of the operation. After parathyroid surgery, you're going to have a small incision down at the base of the neck, sometimes about 2 to 3 inches in size. That incision is going to be closed with some dissolvable stitches under the skin, but skin glue on the surface. I like to put a pressure dressing that's kind of a crisscross dressing that looks really big, but it just holds pressure over that area over the first 24 hours after surgery. So that dressing can be removed 24 hours after the operation was finished. I like people to not shower for the first 48 hours so that they don't get too much water on that incision. But after 48 hours, then they can shower. Water can get on that skin glue. Just don't scrub it or let the water pound on that. After the shower, they can gently dry the area rather than scrubbing any of the skin glue off. The skin glue is pretty tough, but it can come off prematurely. We don't like people to put lotions or ointments on that glue because that can accelerate it coming off, and we really like for that to stay in place. After parathyroid surgery, people are going to have some neck pain, of course, but typically not too much. They're usually able to eat and swallow whatever they want and not have any problems with that. It's probably always a good idea to do bland food for the first 24 hours just because the anesthesia can make people a little bit sick, but there's nothing specific to the parathyroid surgery that requires any special dietary things. We like for people to take a calcium taper, and so you're going to get some instructions on taking some calcium tablets 3 times a day for the first week and then stepping down after that. That just helps bring the calcium levels down a little more slowly than causing them to crash. Postoperatively, people can get some low calcium issues. There's a condition called hungry bone syndrome where your body's trying to suck up all this calcium now that the parathyroid overactivity is not preventing it from doing so. So if someone had low calcium, the usual symptoms they're going to get are tingling around their fingers or around their mouth very commonly, sometimes some drawing or cramping of their hands, or even the sense of dread. So if you have any of those issues, it may be good to get your calcium, you should get your calcium checked to make sure that it's not going too low, because that can be serious. You're usually going to require some pain medication, although you may get by with just Tylenol, but you're probably going to be prescribed some narcotic pain medication to take if you need it. Most of the time you're not going to require any antibiotics, although there is that super small risk of having some postoperative infection. The recurrent laryngeal nerve is a nerve that goes to the vocal cords that goes near the parathyroid, and although we monitor that during these surgeries, there's a very small risk of having hoarseness or voice disorders after parathyroidectomy. Parathyroidectomy is usually a very successful surgery. That one surgery corrects these calcium issues, and so hope that helps. I just want to provide some information about that. If there's any questions or problems or complications that you think have developed after surgery, you can always give us a call at 803-936-7530, and we're available 24/7 through there or through the emergency room. Thank you.